Hello, in this video the short review about the vascular disease we will discuss. So the vascular disease involve heart and the blood vessels. We will classify the cardiovascular disease on the basis of the vascular disease and the heart disease, cardiac. So the cardiovascular disease is too much popular because a lot of complication and a lot of factors. Vascular disease and the heart disease, the cardiac. Let's begin to understand first the vascular disease. Vascular disease involve the coronary artery disease like atherosclerosis or arteriosclerosis, and the peripheral artery disease like aneurysm, and the cerebrovascular disease in the brain will lead to cause stroke, and the aortic aneurysm. While the heart disease involves the cardiomyopathy, hypertensive heart disease, the cardiomyopathy is due to infection or something, heart failure. Heart failure is due to the high blood pressure or low blood pressure, pulmonary heart disease, cardiac dysarrhythmia, irregular heartbeat, systolic and diastolic irregulation, endocarditis inflammation, endocardium inflame, and myocarditis due to the myocardium inflammation. The valvular heart disease, the wall of the heart will lead to stenosis, and the congenital heart disease and rheumatic heart disease. Let's begin to understand the further through diagram here. This is the right atrium and right ventricle, and left atrium and left ventricle. And this is the aorta used for the eject blood throughout the body, while the pulmonary artery used for the pulmonary circulation for oxygen and carbon dioxide exchange. And this is the valves. Valves are also involved for this cardiac disease, and this is the descending aorta, remember. So this is the blood circulatory system move the blood and eject, while the move inside through right atrium to right ventricle. Anyhow, this is the systemic circulation. The systemic circulation, the descending aorta involved, and aneurysm. Anyhow, this is the valve disease involved. This is the normal and the stenosis. The normal is normal, but the stenosis means the heart valve will be rigid and not completely open or closed. So that is why the regurgitation will occur or other problems, and the four sound of the heartbeat during the systolic and diastolic blood pressure identification. This is the fatty deposition in the coronary arteriosclerosis problem, and due to the type 2 diabetes mellitus or other complication. And on the other hand, this is the disorganized electrical signal, and due to the sinoatrial node and atrioventricular node irregulation. While the aortic stenosis, and this is the pericarditis, the inflammation of the pericardium, and this is the thickening of myocardium, is known as the myocarditis. And in this way, the left atrium and ventricle will be thick more, will not completely eject blood, and in this way the output will decrease. The cardiac arrhythmia, and in this way the cardiomyopathy and heart failure, as well as the infected cardiomyopathy can be possible. Let's begin to understand the risk factor. What is the risk factor? Number one thing is that smoking. When we will smoke, the carbon monoxide will increase, will lead to decrease the oxygen, lead to hypoxia. And in this way here you can see this is the fast food and sugars, and the hypoxia will lead to endothelial injury. This is the low density lipoprotein will be increased and high density lipoprotein decrease due to the fast food and sugars. And in this way the high cholesterol will lead to arteriosclerosis. If the type 2 diabetes mellitus, the chances will be more. On the other hand, the high blood pressure and the obesity. Obesity is due to the triacylglycerol will increase in our body, will lead to deposit in the blood circulatory system, tunica intima, will lead to plaque formation and the thrombosis to cause aneurysm, etc. And the physical inactivity. Investigation is the angiography for artery clog, blood pressure test for hypertension, the pulse rate checking like normal the 62 per minute, a rate identification, systolic and diastolic identification, a breathing test, oxygen saturation test and blood test, hypoxemia identification, and the pulmonary edema identification. Urine test are also involved. During the urine test, why? Because urine test is involved to identify the constitution of the urine as well as the sodium. On the other hand, the salt identification, either salt can remove or not. Hypoxia identification of pulmonary edema identification, and the urine test. Let's understand the complication due to the cardiovascular disease. Hypoxia in cell will lead to decrease the oxygen, is known as hypoxia in the tissue, and the hypoxemia in the blood circulatory system will lead to hypoxia in the tissue, will cause cell injury and necrosis. In this way, the cell injury and necrosis will lead to heart attack, and the fatigue, nausea, vomiting, as well as the paralysis, even death. Death of the tissue will lead to cause death for the brain cells, etc., etc. On the other hand, the blood leakage, thrombosis can occur, and death of the patients. Let's begin to understand the prevention. How to prevent the cardiovascular disease? We can decrease the chances of cardiovascular disease 90% if we will take less table salts, sodium chloride, the 10 milligram per day. On the other hand, 10 gram per day. Fast food decrease, water more intake due to the flushing of the sodium, alcohol decrease, and smoking decrease. Thanks for watching. If you like this video, please make sure to subscribe, like, and share, and give the comment below to understanding better, and give the suggestion. Thanks for watching. See you in the next video. For this time, bye.